How to lower blood pressure naturally without medication. High blood pressure, medically known as hypertension, silently affects nearly half of all American adults, earning its notorious reputation as the silent killer. This comprehensive guide presents evidence-based natural approaches that can significantly reduce your blood pressure readings without pharmaceutical intervention, offering hope and practical solutions for millions seeking healthier alternatives. Understanding the critical nature of high blood pressure. Blood pressure represents the force your blood exerts against arterial walls as your heart pumps life-sustaining fluid throughout your body. When this pressure consistently exceeds normal ranges, typically defined as readings above 130/80 mmHg, your cardiovascular system enters a state of chronic stress that can lead to devastating health consequences, including heart attack, stroke, kidney disease, and premature death. The alarming statistics paint a sobering picture of this epidemic, with cardiovascular disease claiming more American lives annually than cancer accidents and respiratory diseases combined. Yet many individuals remain unaware of their elevated blood pressure status because hypertension rarely produces obvious symptoms until irreversible damage has already occurred to vital organs. Medical professionals classify blood pressure into distinct categories that help determine appropriate intervention strategies, with normal readings falling below 120/80 mmHg, elevated readings ranging from 120 to 129, systolic with diastolic below 80, stage 1 hypertension encompassing systolic readings between 130 to 49, or diastolic between 80 to 89, and stage 2 hypertension representing readings consistently at or above 140/90 mmHg. Understanding these classifications empowers you to recognize where your current readings fall and appreciate the urgency of implementing natural interventions before your condition progresses to more dangerous stages requiring aggressive pharmaceutical management. The earlier you begin natural blood pressure reduction strategies, the greater your chances of avoiding medication dependency and preventing serious cardiovascular complications. The revolutionary power of dietary modifications. Nutrition serves as the foundation for natural blood pressure management, with specific dietary patterns demonstrating remarkable ability to reduce both systolic and diastolic readings within weeks of implementation. The foods you consume directly influence blood vessel function, fluid balance, inflammation levels, and arterial flexibility, making dietary intervention one of the most powerful tools in your natural blood pressure reduction arsenal. The Mediterranean diet, extensively studied and consistently validated by cardiovascular researchers worldwide, emphasizes whole foods that naturally support healthy blood pressure through multiple physiological mechanisms. This eating pattern prioritizes fresh vegetables, fruits, whole grains, legumes, nuts, seeds, olive oil, and moderate amounts of fish while minimizing processed foods, refined sugars, and excessive sodium intake. Potassium-rich foods deserve special attention in any blood pressure reduction strategy because this essential mineral directly counteracts sodium's blood pressure, elevating effects by promoting sodium excretion through the kidneys and supporting healthy blood vessel dilation. Excellent potassium sources include bananas, sweet potatoes, spinach, avocados, white beans, salmon, and coconut water, with daily intake targets ranging from 30,000 500 to 40,700 milligrams for optimal cardiovascular benefit. Magnesium deficiency affects approximately 50% of Americans and contributes significantly to elevated blood pressure through impaired blood vessel relaxation and increased arterial stiffness. Incorporating magnesium, rich foods such as dark leafy greens, pumpkin seeds, almonds, dark chocolate, and quinoa can help restore optimal levels and support natural blood pressure reduction. The DASH diet, specifically designed by nutrition researchers to combat hypertension, emphasizes foods naturally high in potassium, magnesium, calcium, and fiber, while restricting sodium-saturated fats and added sugars. Clinical trials consistently demonstrate that DASH diet adherence can reduce systolic blood pressure by 8 to 14 mmHg within just 2 weeks of implementation. Sodium reduction represents perhaps the most immediately impactful dietary modification for blood pressure management, with most Americans consuming nearly double the recommended daily limit of 2,300 milligrams. Processed and restaurant foods contribute approximately 75% of dietary sodium, making home cooking with fresh ingredients essential for achieving meaningful sodium reduction. Hidden sodium sources lurk in seemingly innocent foods, including bread cereals, canned soups, deli meats, cheese, and condiments, requiring careful label reading and ingredient awareness to identify and eliminate excessive sodium intake. Replacing high-sodium processed foods with fresh alternatives can reduce blood pressure readings by 5 to 10 mmHg within several weeks. Strategic physical activity for cardiovascular transformation. Regular physical activity acts as natural medicine for your cardiovascular system, producing immediate and long-term blood pressure benefits through multiple physiological adaptations, including improved heart efficiency, enhanced blood vessel flexibility, reduced arterial stiffness, and optimized nervous system function. Even modest increases in daily activity can yield measurable blood pressure improvements within days of implementation. Aerobic exercise encompassing activities that elevate heart rate and breathing for sustained periods represents the gold standard for natural blood pressure reduction because it directly strengthens your heart muscle, improves circulation, and promotes healthy blood vessel function. Research consistently demonstrates that regular aerobic activity can reduce systolic blood pressure by 4 to 9 mmHg and diastolic pressure by 3 to 6 mmHg. Walking emerges as the most accessible and sustainable form of aerobic exercise for blood pressure management, requiring no special equipment, gym membership, or advanced fitness level, while delivering profound cardiovascular benefits. Brisk walking for 30 minutes daily, achievable through 3 10-minute sessions, if continuous exercise proves challenging, can produce clinically significant blood pressure reductions within 4 to 6 weeks. Swimming provides exceptional cardiovascular conditioning while minimizing joint stress, making it ideal for individuals with arthritis, obesity, or mobility limitations who struggle with weight-bearing exercises. The hydrostatic pressure of water naturally supports circulation and can provide additional blood pressure benefits beyond traditional land-based activities. Cycling, whether outdoors or on stationary equipment, offers excellent cardiovascular conditioning while building leg strength and endurance. Regular cycling sessions of 20 to 30 minutes can improve heart function, reduce resting heart rate, and contribute to meaningful blood pressure reductions when performed consistently. Resistance training, once controversial for individuals with high blood pressure, now receives strong endorsement from cardiovascular specialists when performed correctly with appropriate supervision. Strength training exercises using moderate weights or resistance bands can improve muscle strength, bone density, and metabolic function while contributing to blood pressure reduction. High-intensity interval training represents an advanced exercise strategy that alternates brief periods of vigorous activity with recovery intervals, producing superior cardiovascular adaptations in shorter timeframes compared to traditional steady-state exercise. HIIT protocols can reduce blood pressure more effectively than moderate-intensity continuous exercise while requiring significantly less time commitment. The timing of exercise affects blood pressure response, with morning workouts providing the greatest benefit for individuals whose blood pressure typically peaks during early hours. However, any consistent exercise schedule that fits your lifestyle and preferences will deliver meaningful cardiovascular benefits and blood pressure improvements. Mastering stress management for cardiovascular health. Chronic stress represents a major, yet often overlooked contributor to elevated blood pressure through complex interactions between your nervous system, hormonal responses, and cardiovascular function. Persistent stress triggers release of cortisol, adrenaline, and other hormones that directly elevate blood pressure while promoting inflammation and arterial damage. The stress response system, designed for brief emergency situations, becomes maladaptive when constantly activated by modern life challenges, including work pressures, financial concerns, relationship conflicts, and information overload. This chronic activation maintains elevated blood pressure levels and prevents natural relaxation responses that allow cardiovascular recovery. Deep breathing exercises offer immediate blood pressure benefits by activating your parasympathetic nervous system, the branch responsible for rest and recovery responses. Slow, controlled breathing patterns can reduce blood pressure within minutes while promoting overall cardiovascular relaxation and stress hormone reduction. Progressive muscle relaxation techniques involve systematically tensing and releasing muscle groups throughout your body, promoting physical and mental relaxation while reducing stress hormone levels and blood pressure readings. Regular practice of these techniques can provide lasting stress management benefits and cardiovascular protection. Meditation practices supported by extensive scientific research demonstrate remarkable ability to reduce blood pressure through stress reduction, improved emotional regulation, and enhanced nervous system balance. Even brief daily meditation sessions of 10 to 20 minutes can produce measurable blood pressure improvements within weeks of consistent practice. Mindfulness-based stress reduction programs combine meditation, gentle movement, and awareness techniques to help individuals develop healthier responses to stress while reducing blood pressure and improving overall cardiovascular health. These comprehensive approaches address both psychological and physiological aspects of stress-related hypertension. Yoga integrates physical postures, breathing techniques, and meditation practices to provide comprehensive stress management and blood pressure benefits. Regular yoga practice can improve flexibility, strength, and balance while reducing stress hormones and promoting cardiovascular relaxation. Time management strategies help reduce daily stress by creating structure priorities and boundaries that prevent overwhelming situations from triggering excessive stress responses. Effective time management includes realistic goal setting, task prioritization, delegation when possible, and building buffer time for unexpected challenges. Social support networks play crucial roles in stress management and blood pressure control, with strong relationships providing emotional resources, practical assistance, and stress buffering effects. Maintaining meaningful connections with family, friends, or community groups can significantly impact cardiovascular health outcomes. Optimizing sleep for blood pressure control. Sleep quality and duration directly influence blood pressure regulation through complex interactions between circadian rhythms, stress hormone production, and cardiovascular recovery processes. Inadequate or poor quality sleep consistently elevates blood pressure while impairing natural overnight blood pressure dipping that provides cardiovascular restoration. Normal blood pressure patterns include a natural decrease of 10 to 20% during sleep, allowing your cardiovascular system to recover from daily stresses and prepare for the next day's challenges. Disrupted sleep patterns prevent this essential dipping response, maintaining elevated blood pressure throughout the night and contributing to overall hypertension. Sleep apnea, affecting millions of Americans, represents a serious yet treatable condition that significantly elevates blood pressure through repeated episodes of breathing cessation during sleep. These episodes trigger stress responses that spike blood pressure and prevent restorative sleep, creating a cycle of cardiovascular stress and inadequate recovery. Creating optimal sleep environments involves controlling temperature, lighting, noise, and comfort factors that influence sleep quality and duration. Maintaining bedroom temperatures between 65 to 68 degrees Fahrenheit, minimizing light exposure, reducing noise disruptions, and investing in comfortable bedding can significantly improve sleep quality and blood pressure outcomes. Sleep hygiene practices encompass daily habits and routines that promote consistent restorative sleep patterns essential for blood pressure management. Effective sleep hygiene includes maintaining regular bedtime and wake schedules, avoiding caffeine and large meals before bedtime, limiting screen time in the evening, and creating relaxing pre-sleep routines. Blue light exposure from electronic devices disrupts natural circadian rhythms and melatonin production, interfering with sleep initiation and quality. Implementing blue light filters, avoiding screens for at least 1 hour before bedtime, or using blue light blocking glasses can improve sleep quality and support healthy blood pressure patterns. Natural sleep aids, including melatonin, magnesium, and herbal teas, can support healthy sleep patterns without the side effects associated with prescription sleep medications. These natural approaches work with your body's existing sleep mechanisms to promote relaxation and improve sleep quality. Weight management for cardiovascular optimization. Excess body weight directly contributes to elevated blood pressure through multiple mechanisms, including increased blood volume, enhanced sodium retention, elevated insulin levels, and increased sympathetic nervous system activity. Even modest weight loss of 5 to 10 pounds can produce meaningful blood pressure reductions and cardiovascular benefits. Abdominal weight gain poses particular risks for blood pressure elevation because visceral fat tissue produces inflammatory compounds and hormones that directly affect cardiovascular function. Measuring waist circumference provides valuable information about cardiovascular risk, with measurements exceeding 40 inches in men or 35 inches in women, indicating increased hypertension risk. Sustainable weight loss approaches focus on gradual lifestyle-based changes rather than extreme diets or temporary restrictions that prove difficult to maintain long-term. Successful weight management requires addressing eating behaviors, physical activity levels, stress factors, and environmental influences that contribute to weight gain. Portion control strategies help manage caloric intake without requiring complex calorie counting or food restrictions, using smaller plates, measuring serving sizes, eating slowly to recognize satiety signals, and avoiding distractions during meals can significantly reduce overall caloric intake and support weight loss efforts. Meal timing affects metabolism, hunger hormones, and weight management success with regular meal schedules supporting stable blood sugar levels and reducing overeating tendencies. Eating larger portions earlier in the day and smaller portions in the evening aligns with natural circadian rhythms and can enhance weight loss efforts. Hydration plays important roles in weight management and blood pressure control, with adequate water intake supporting metabolism, reducing false hunger signals, and helping eliminate excess sodium. Drinking water before meals can increase satiety and reduce caloric intake while supporting overall cardiovascular health. Fiber-rich foods provide satiety, support healthy digestion, and contribute to weight management, while offering additional blood pressure benefits through improved cholesterol levels and reduced inflammation, targeting 25 to 35 grams of fiber daily through vegetables. Fruits, whole grains, and legumes supports both weight loss and cardiovascular health. Limiting alcohol and eliminating tobacco. Alcohol consumption presents a complex relationship with blood pressure, providing potential benefits in very small amounts while causing significant harm in larger quantities. Understanding this relationship helps guide decisions about alcohol use in the context of natural blood pressure management strategies. Light to moderate alcohol consumption, defined as no more than 1 drink daily for women or 2 drinks daily for men, may provide modest cardiovascular benefits through improved HDL cholesterol levels and reduced blood clotting. However, these potential benefits must be weighed against risks, including dependency accidents and interactions with medications. Excessive alcohol intake consistently elevates blood pressure through multiple mechanisms, including increased heart rate, enhanced stress, hormone production, weight gain, and interference with sleep quality. Binge drinking episodes can cause dangerous blood pressure spikes that persist for days after alcohol consumption ends. Alcohol withdrawal in individuals with dependency can cause severe blood pressure elevations, requiring medical supervision. Anyone consuming alcohol regularly should consult healthcare providers before making significant changes to their alcohol intake patterns, especially if they have existing cardiovascular conditions. Tobacco use represents one of the most significant modifiable risk factors for cardiovascular disease, causing immediate and long-term blood pressure, elevation through nicotine, induced vasoconstriction, increased heart rate, arterial damage, and enhanced blood clotting. Quitting tobacco provides immediate cardiovascular benefits that continue to improve over time. Smoking cessation produces rapid blood pressure improvements, with some benefits appearing within hours of quitting as nicotine levels decline and blood vessels begin to relax. Within 1 year of quitting, cardiovascular disease risk drops by approximately 50% compared to continued smoking. Secondhand smoke exposure also elevates blood pressure and increases cardiovascular disease risk, making smoke-free environments important for everyone seeking optimal cardiovascular health. Avoiding environments with tobacco smoke protects against acute blood pressure elevations and long-term cardiovascular damage. Nicotine replacement therapies, including patches, gums, and prescription medications, can support smoking cessation efforts, while managing withdrawal symptoms that might temporarily affect blood pressure. Working with healthcare providers ensures safe and effective tobacco cessation strategies. Natural supplements and herbal approaches. Certain natural supplements demonstrate scientific evidence for blood pressure reduction, though they should complement rather than replace lifestyle modifications and medical care. Understanding evidence-based supplement options helps inform decisions about incorporating these tools into comprehensive blood pressure management strategies. Garlic supplements, particularly aged garlic extract, show consistent blood pressure lowering effects in clinical trials with typical reductions of 8 to 10 mmHg systolic and 5 to 6 mmHg diastolic when used consistently for several months. Garlic appears to work through multiple mechanisms, including improved blood vessel function and reduced arterial stiffness. Hibiscus tea provides significant blood pressure benefits, comparable to some prescription medications, with studies showing reductions of 7 to 13 mmHg systolic when consumed regularly. Hibiscus contains antioxidants and compounds that support healthy blood vessel function and may help reduce blood pressure through natural diuretic effects. Coenzyme Q10 supplementation can reduce blood pressure in individuals with hypertension, particularly those with coenzyme Q10 deficiency. Typical dosages range from 100 to 200 milligrams daily, with blood pressure benefits appearing after 4 to 12 weeks of consistent use. Omega-3 fatty acids from fish oil or algae sources provide modest blood pressure benefits while supporting overall cardiovascular health through anti-inflammatory effects and improved blood vessel function. Effective dosages typically range from 1,000 to 3,000 milligrams daily of combined EPA and DHA. Magnesium supplementation can help reduce blood pressure in individuals with magnesium deficiency, which affects approximately half of the American population. Effective dosages range from 200 to 400 milligrams daily with magnesium glycinate or citrate forms, providing better absorption than magnesium oxide. Potassium supplements may benefit individuals unable to achieve adequate potassium intake through dietary sources alone. However, potassium supplementation requires medical supervision because excessive levels can cause dangerous heart rhythm abnormalities, particularly in individuals with kidney disease or those taking certain medications. Hawthorn extract demonstrates blood pressure, lowering effects in some studies, though results remain inconsistent and more research is needed to establish optimal dosing and safety profiles. Hawthorn may interact with heart medications and should be used only under medical supervision. Hydration and electrolyte balance. Proper hydration supports healthy blood pressure through optimal blood volume, kidney function, and electrolyte balance. Dehydration can elevate blood pressure by reducing blood volume and triggering compensatory responses that increase heart rate and vasoconstriction. Water intake requirements vary based on body size, activity level, climate, and overall health status, with general recommendations ranging from 8 to 12 cups daily for most adults. Monitoring urine color provides a practical hydration assessment tool, with pale yellow indicating adequate hydration and dark yellow suggesting dehydration. Electrolyte balance affects blood pressure regulation through complex interactions between sodium, potassium, magnesium, and calcium. Maintaining proper ratios of these minerals supports healthy blood vessel function and fluid balance, essential for optimal cardiovascular performance. Excessive sodium intake disrupts electrolyte balance and promotes fluid retention, elevating blood pressure through increased blood volume and arterial pressure, reducing sodium while maintaining adequate potassium intake helps restore healthy electrolyte ratios and supports blood pressure reduction. Natural electrolyte sources, including coconut water, sea salt in moderation, and mineral-rich foods, provide balanced electrolyte support without the artificial additives and excessive sugars found in many commercial sports drinks. These natural options support hydration and electrolyte balance for individuals engaging in regular physical activity. Hard water containing higher levels of magnesium and calcium may provide cardiovascular benefits compared to soft water with lower mineral content. Some research suggests that individuals living in hard water areas have lower rates of cardiovascular disease, though this relationship requires further investigation. Environmental factors and blood pressure. Environmental exposures, including air pollution, noise pollution, extreme temperatures, and chemical contaminants, can significantly impact blood pressure through stress responses, inflammation, and direct cardiovascular effects. Identifying and minimizing these exposures supports natural blood pressure management efforts. Air pollution, particularly fine particulate matter and ozone, consistently elevates blood pressure through inflammatory responses and direct effects on blood vessel function. Individuals living in high pollution areas should consider air filtration systems, avoid outdoor exercise during high pollution periods, and support policies that improve air quality. Noise pollution from traffic, construction, airports, and other sources triggers stress responses that elevate blood pressure and disrupt sleep patterns essential for cardiovascular recovery. Minimizing noise exposure through soundproofing white noise machines or relocating when possible can support blood pressure management. Extreme temperatures, both hot and cold, can affect blood pressure through changes in blood vessel dilation and constriction. Individuals with hypertension should take precautions during temperature extremes, including staying hydrated in heat, dressing appropriately for cold, and avoiding sudden temperature changes when possible. Chemical exposures from household cleaners, pesticides, plastics, and industrial sources may contribute to blood pressure elevation through various mechanisms, including endocrine disruption and inflammation. Choosing natural cleaning products, organic foods, when possible, and reducing plastic use can minimize these exposures. Light exposure patterns affect circadian rhythms and sleep quality, which directly influence blood pressure regulation. Maintaining consistent exposure to natural light during daytime hours while minimizing artificial light in the evening supports healthy sleep patterns and blood pressure control. Building sustainable lifestyle changes. Successful blood pressure management requires sustainable lifestyle changes rather than temporary interventions. Developing realistic, enjoyable, and personally meaningful approaches increases adherence and long-term success while preventing the frustration and disappointment associated with unsustainable extreme measures. Goal-setting strategies should emphasize specific, measurable, achievable, relevant, and time-bound objectives that provide clear direction and motivation. Starting with small, manageable changes builds confidence and momentum, while establishing foundations for more significant lifestyle modifications over time. Habit formation principles suggest that consistent daily practices become automatic behaviors within 21 to 66 days, depending on complexity and individual factors. Focusing on one or two key changes at a time allows for proper habit establishment before adding additional modifications. Self-monitoring tools, including blood pressure logs, food diaries, Exercise trackers and stress journals provide valuable feedback and motivation while helping identify patterns and triggers that affect blood pressure readings. Regular monitoring helps maintain awareness and accountability for lifestyle choices. Social support systems significantly influence success with lifestyle changes, providing encouragement, accountability, and practical assistance during challenging periods. Engaging family members, friends, or joining support groups creates environments that support rather than undermine healthy lifestyle choices. Professional guidance from healthcare providers. Registered dietitians, certified personal trainers, or other qualified professionals can provide personalized recommendations, safety oversight, and motivation, while helping navigate complex health situations or medication interactions. Flexibility and adaptability remain essential for long-term success, allowing for adjustments based on changing circumstances, preferences, or health status. Rigid approaches often lead to failure and frustration, while flexible approaches accommodate real-life challenges and promote sustained commitment. Monitoring progress and maintaining motivation. Regular blood pressure monitoring provides essential feedback about the effectiveness of natural interventions while helping identify trends and patterns that guide ongoing lifestyle modifications. Proper monitoring techniques ensure accurate readings that reflect true cardiovascular status. Home blood pressure monitoring offers several advantages over occasional clinic readings, including elimination of white coat hypertension, multiple readings over time, and convenience that encourages regular monitoring. Choosing validated monitors and following proper measurement techniques ensures reliable results. Proper blood pressure measurement requires appropriate cuff size, correct arm positioning, adequate rest period before measurement, and avoiding factors that can artificially elevate readings, including caffeine, consumption, exercise, and stress. Following standardized protocols improves accuracy and consistency. Blood pressure variability is normal throughout the day, with typical patterns including lower readings during sleep, gradual increases upon awakening, and fluctuations related to activities, stress, and other factors. Understanding normal variability prevents unnecessary concern about minor fluctuations. Target blood pressure goals vary based on age, health status, and risk factors, with general targets below 130/80 mmHg for most adults. Individuals should work with healthcare providers to establish personalized targets that consider their specific circumstances and cardiovascular risk profiles. Additional health markers, including resting heart rate, weight, waist circumference, sleep quality, energy levels, and overall well-being, provide valuable information about cardiovascular health improvements beyond blood pressure readings alone. Tracking multiple indicators provides comprehensive feedback about health progress. Celebrating milestones and acknowledging progress maintains motivation during the gradual process of lifestyle change and blood pressure improvement. Recognizing both small victories and major achievements helps sustain commitment during challenging periods when progress may seem slow. Long-term maintenance and advanced strategies. Maintaining blood pressure improvements requires ongoing commitment to healthy lifestyle practices rather than temporary interventions. Developing long-term strategies that accommodate changing life circumstances ensures sustained cardiovascular benefits and continued blood pressure control. Advanced dietary strategies may include intermittent fasting, protocols, elimination diets to identify food sensitivities, specialized eating patterns for specific health conditions, or working with registered dietitians to optimize individual nutritional needs. These approaches should be pursued under professional guidance. Exercise progression involves gradually increasing intensity, duration, or variety of physical activities to continue challenging your cardiovascular system and maintaining fitness improvements. Proper progression prevents plateaus while reducing injury risks associated with sudden increases in activity levels. Stress management evolution may include advanced meditation techniques, professional counseling for ongoing stress issues, career or relationship changes that reduce chronic stress sources, or specialized stress reduction programs for specific situations. Addressing underlying stress sources provides more sustainable solutions than symptom management alone. Medical integration ensures that natural approaches complement rather than conflict with necessary medical care. Regular communication with healthcare providers, appropriate monitoring of health status, and willingness to incorporate medications when natural approaches prove insufficient maintain safety while optimizing outcomes. Technology integration, including smartphone apps, wearable devices online, support communities, and telemedicine consultations, can enhance natural blood pressure management through improved monitoring, education, motivation, and professional guidance. Choosing evidence-based tools that align with personal preferences increases utilization and effectiveness. Continued education about cardiovascular health, emerging research, and new natural approaches maintains engagement and provides opportunities for ongoing improvement. Staying informed through reputable sources helps distinguish between evidence-based strategies and unproven claims that may waste time or resources. Conclusion and call to action. Natural blood pressure management represents a powerful evidence-based approach that can significantly reduce cardiovascular disease risk while improving overall health and quality of life. The strategies outlined in this comprehensive guide provide practical, sustainable tools for achieving meaningful blood pressure reductions without pharmaceutical interventions. The journey toward optimal blood pressure requires commitment, patience, and consistency as your body adapts to healthier lifestyle patterns and begins to demonstrate measurable improvements. Most individuals begin seeing blood pressure benefits within 2 to 8 weeks of implementing comprehensive, natural approaches with continued improvements over months and years of sustained practice. Success depends on selecting strategies that align with your personal preferences, lifestyle circumstances, and health status while maintaining realistic expectations about the gradual nature of sustainable change. Attempting to implement all strategies simultaneously often leads to overwhelm and failure, while focusing on key areas provides manageable starting points for meaningful transformation. Professional support enhances safety and effectiveness while providing personalized guidance that addresses individual health circumstances, medication interactions, and specific cardiovascular risk factors. Healthcare providers can help determine which natural approaches offer the greatest potential benefits while monitoring for any concerning changes in health status. The time to begin implementing natural blood pressure management strategies is now before elevated readings progress to more dangerous levels, requiring aggressive medical intervention. Every day of delay represents missed opportunities for cardiovascular protection and potential progression of arterial damage that becomes increasingly difficult to reverse over time. Your cardiovascular health remains largely within your control through daily choices about nutrition, physical activity, stress, management, sleep habits, and other lifestyle factors that directly influence blood pressure readings. Embracing this empowerment provides motivation and hope for achieving optimal cardiovascular wellness through natural approaches that support your entire body's health and vitality.